Thank you, Acting President. I'm pleased to have the opportunity to speak on the Health Legislation Amendment and Repeal Bill 2019. This bill is an omnibus bill which introduces changes to several acts. The repeal of the Access to Medical Cannabis Act 2016 demonstrates how far Australia has really come in our first steps towards a more rational approach to drugs. The federal scheme makes the state laws redundant, and we can hope that more work continues to ease the pathway of access for unwell people to get access to effective medication. It would be no surprise to members present here that the part of the bill that is of most concern to me involves changes to the Tobacco Act 1987. Before getting into the specifics of these changes, I think it's worth reflecting on the stated objective of the Tobacco Act. The preamble covers the risks of tobacco and smoking and the need to discourage people from smoking. The objects of the Act highlight the promotion, and I quote, the promotion of health and illness prevention. The bill before the House brings in further restrictions on advertising and sponsorship for tobacco companies. While this is in line with previous reforms in Australia, we are slightly different to many other comparable countries in that we have regulated e-cigarettes as though it was the same as smoking. This may well undermine the very aims of the Tobacco Act itself. While there have been suggestions that proponents and advocates for vaping are somehow in the pocket of big tobacco, this shows an astounding ignorance of what vaping is, who it benefits, and how the technology was created and has evolved. The modern iteration of e-cigarettes began with Chinese pharmacist and medical researcher Hon Lik, who was terribly addicted to cigarettes and feared that he would follow his father's fate and die of smoking-related illnesses. After an inspiration in a dream, he developed the first e-cigarette product and patented it in 2006. For the next several years, ex-smokers tinkered with the new products, creating improvements, new techniques and sharing tips between each other. The industry developed and evolved without government support and for a long time without government interest, as smokers found a new way to improve their health and kick the habit of smoking. Big tobacco was nowhere to be seen, and their involvement in the market is a relatively new phenomenon. Over the last couple of months, opponents of vaping have jumped on a recent emergence of health issues related to vaping. They've been waiting for some significant health issue related to vaping and thought they finally found their opportunity. They have jumped the gun, however, and probably done harm to public health in their efforts. Updated information from the Centre for Disease Control in the United States says that about 80% of confirmed cases involve illicit cannabis products. A lab in Colorado may have highlighted the specifics of these cases, suggesting that the presence of cadmium in some silver solder may have created a reaction known as metal flume fever and a particularly concerning variety called cadmium pneumonitis. But those opposed to tobacco harm reduction would never let the facts get in the way of a good story, using this incident isolated to the USA as a way to discredit the safety of all vaping products. Rather than considering this for what it is, black market and poorly regulated products. To claim that proponents of vaping are not concerned with public health is to claim that the UK and New Zealand are somehow singing to the tune of big tobacco. The New Zealand Ministry of Health encourages smokers who want to use vaping products to quit smoking to seek the support of local stop smoking services. Local stop smoking services provide smokers with the best chance of quitting successfully and must support smokers who want to quit with the help of vaping products. Is there really suggestion that the government led by Prime Minister Jacinda Ardern is undermining public health by supporting vaping? I would encourage members that are still confused to visit vapingfacts.health.nz. The New Zealand Health Department seems to be actually interested in facts rather than spurious accusations that are based on paranoia that somehow all of the science and actual experience of ex-smokers who credit vaping with saving their lives are somehow just puppets of big tobacco. Meanwhile, in the United Kingdom, 2 vaping stores have recently opened inside hospitals. Rather than strangling the emerging vaping market, it is being actively supported by the agencies concerned with reducing smoking and the burden of disease, the very aims of the Tobacco Act. Economic modelling conducted by the New Zealand Ministry of Health has highlighted that a liberal approach to vaping has the possibility of both net health gains and economic savings. The researchers have pledged to make this data available for other health departments if the Health Minister wishes to take them up on this offer. As it goes to the heart of questions about advertising and health promotion, I will quote a section from a 2016 peer-reviewed article published in BMC Public Health titled "Obsolete Tobacco Control Measures Can Be Hazardous to Public Health," and I quote, When the cigarette control movement learned to oppose the powerful pro-tobacco arguments with evidence-based, symbolically charged responses, it was a large leap forward for cigarette control. When these arguments are misapplied to products that do not approach cigarettes in the damage caused to users and bystanders, it is fallacious, misleading and compromising to credibility. While it has been feared that alternative nicotine delivery systems will re-normalise smoking, it could be likelier that the availability of satisfying and much less dangerous cigarette substitutes will act to make it all the more abnormal for someone to be smoking deadly cigarettes that are combustible. For those who want to advance tobacco control should appreciate that A, cigarette combusted tobacco control remains the highest priority, and B, the arguments against the use of products like vape and snus should not be grounded inappropriately in broad-based all-or-nothing anti-cigarette arguments." End quote. And if you're wondering what snus is, it's like a little tea bag with tobacco that people in Sweden put in their mouth instead of smoking, which has resulted in Sweden having one of the lowest rates of lung cancer in the world. Everything written about smoking and public health highlights the fact that disadvantaged groups have higher rates of smoking and higher risks of suffering the health-related harms. Indeed, the debate on this bill in the other place highlighted that rural communities have higher rates of smoking than metropolitan regions and have less access to quality health services when they suffer poor health related to their tobacco use. One of the tragedies of our current approach to vaping is that it further exacerbates this disparity. For the well-educated, well-off and internet-savvy smoker wanting to use vaping as a pathway to quit, they can easily do this. But for rural people, people without internet access or without easy access to specialist vaping retailers or people that are less likely to have friends who vape, this becomes all the much harder. This year has seen more evidence emerging about the relative safety of these products as a smoking cessation tool. The New England Journal of Medicine published a randomised controlled trial that demonstrated e-cigarettes are almost twice as effective as other nicotine replacement therapies. Significantly, this was partially funded by Cancer Research UK, hardly a supporter of the tobacco industry. In August of this year, a review of the research into the respiratory effects of e-cigarettes published in Expert Review of Respiratory Medicine concluded that e-cigarettes have a significantly lower risk to respiratory health. The evidence is there for people to review themselves, but there is a strange phenomenon with vaping. If there is the slightest whisper of tobacco companies anywhere near it, suddenly the evidence doesn't seem to matter. If this approach was taken with renewable energy, support would evaporate with the involvement of fossil fuel companies in renewables. We often hear in debates about important matters that we need to listen to the affected communities. What about ex-smokers that have used vaping to quit? Governments in Australia seem content to disregard and demean the real-world experience of people who credit these smoking alternatives with improving their health or indeed saving their lives. A recent survey of 3,300 vapers conducted by Legalise Vaping Australia gives some insight into what this group looks like. 75% had smoked for longer than 10 years. 75% had tried and failed to quit smoking using nicotine gum. 76% had tried and failed to quit using nicotine patches. 48% had tried 4 different methods of quitting before turning to vaping, and more than 93% of Australian vapers want the ingredients in all vape liquids to be listed, and 87% want vaping equipment to meet the same standards as other electronics sold in Australia. The issue of youth uptake of vaping has been raised when vaping has been debated previously. The LVA survey found that less than 1 in 400 vapers are under 18. Professor Hayden McRobbie, one of the authors of the previously mentioned research in the New England Journal of Medicine, appeared on Radio National's Health Report earlier this week. Rather than an epidemic of youth vapers, the rates quoted on the program for under 18s that have never smoked taking up vaping were about 0.5% in the UK, 0.4% in New Zealand and 0.1% in the United States. It's perhaps worth quickly touching on the research of Dr. Stephen Bright, a senior lecturer in addiction studies at Edith Cowan University. In 2013, he was the lead author in a study that looked at drug moral panics in the media and how they interacted with consumer behaviour. The findings highlighted that moral panics about new drug trends, rather than discouraging use, actually saw an uptick in curiosity and experimentation. In the modern media environment, this is an important consideration while we're considering legislation targeted specifically around advertising tobacco and e-cigarettes. If we appropriately regulate vaping products and discourage youth uptake with the recognition that we can never control all behaviour, we will see large benefits to public health in line with the aims of the Tobacco Act. If we panic about very small rates of vaping among Australians' youth, Dr. Bright's research suggests that the outcome of this will be essentially to advertise the products through the media and shared on social media, undermining the very aims of the amendments before this House. Last year, the Federal Government Standing Committee on Health, Aged Care and Sport reported on the use and marketing of e-cigarettes, and Federal Member for Bowman, Andrew Laming, wrote what may be the shortest dissenting report in history, and I quote, "Life is short and shorter for smokers. Just legalise vaping." That was his report. The Liberal Democrats will support this bill. However, we do have some concerns, as we said, about nicotine delivery. We also have two amendments which I'd like circulated now, please.
Thank you, Mr. Limbrick.
Thank you, Acting President. The two amendments I've proposed to the Health Legislation Amendment and Repeal Bill 2019 are relatively simple. I won't rehash all the arguments in my earlier speech, but I think the broader issues were well covered. So the first amendment goes towards rectifying a failure in the Tobacco Act that undermines the very aims of this Act. It removes the state prohibition on smokeless forms of tobacco. While I understand that there are still federal prohibitions on the importation of these products, my argument is similar to my arguments on nuclear prohibition. Removing the state prohibitions is the right thing to do. It seems like madness that the only form of tobacco that is legal is the most harmful form. In Sweden, the main country that has a wide use of oral tobacco called snus, which I mentioned earlier, they have far surpassed our efforts in reducing smoking. Tobacco consumption is higher, yet smoking is the lowest in Europe. In fact, Sweden has the lowest rate of lung cancer in males who use snus at a higher rate in the world. As with the push against vaping here, there are people that are just not interested in the evidence. Its use has been researched for long periods in large populations with rigorously designed studies. These studies estimate that it has maybe 1% of the harm of smoking tobacco, and that it tends to displace smoked tobacco rather than add to overall tobacco use. If we want to address the harms of tobacco, we should probably look at one of the countries that has gone the furthest in achieving this. The second amendment is really quite modest change. When the vaping industry was regulated by the last government in 2016, the only stores that were currently operating were eligible to be regulated as, I quote, certified specialist e-cigarette retailing premises. These regulations do not allow the sale of tobacco or indeed nicotine. Nevertheless, they are regulated as specialist providers as though they were fancy cigar stores. While these regulations are still overly restrictive, for a store that does not sell any addictive products at all, they at least provide some guidance for stores and allow them to display the products that people have walked into the store to purchase. This modest amendment would simply allow stores that are essentially operating as specialist e-cigarette retailers to operate as such by the government's own guidelines. It is not an amendment to legalise the retailing of nicotine. Australian companies will still have to set up shop in New Zealand and ship back to the discerning customers in Australia. It will not allow companies to start advertising the benefits of vaping. It will not result in large-scale liberalisation of the vaping market, despite the fact that this would address the aims of the Tobacco Act more broadly. This amendment simply allows consistency of regulation for the current status quo and provides guidance for the inspectors that ensure compliance to understand how these stores are supposed to operate. Thank you very much.
Thank you, Mr. Limbrick.